So you joined Chiro Health USA, or most of you did, because you wanted to become more compliant. And quite frankly, that's why I started the company. But what I found, and what many doctors have found, is that as you become more compliant, it can actually lead to growing your practice when you're offering Chiro Health USA. So if you want to see more patients transition from insurance to private pay, stop seeing them run out when their insurance runs out, you want to see more families, you want to stop losing those shopper calls, if you want to compete with the in-network doctors even when you're out of network, and more recently, help patients deal with those crazy high deductibles and see them start and continue care in your office. And if you want to see over 90% of your Medicare patients willingly pay for non-covered service, you're in the right place. You can do all of this as part of Chiro Health USA if you know the right way to explain it. And we've got some simple scripts that can help you accomplish all of the above and really focus on growing your practice. Here's the most important goal. And you folks that are running our front desk and insurance offices, I don't know how you do it sometimes. That's tough enough, but then we need to set our financial policy, leave it alone, and let the professionals handle it from there. So I just want to encourage you, make everybody's life easier. You have a set fee schedule. Let's just make sure that we stick to it and abide by it. I want to clarify a couple of things about what Chiro Health USA is and what it is not. Because believe it or not, there are still some people who are using this program who think it's just for cash patients. It is for every patient who has non-covered services. Now that can include cash. It can be Medicare for their non-covered services. It can be for patients with limited benefits. It can be for families and those patients who have high deductibles and copays. What it is not, this is not a time of service discount program. It's a contractual network agreement, much like your Blue Cross, Aetna, and Cigna. And so it is up to you when you collect your fees. So when you join Chiro Health USA, what should have happened to your cash fee? You need to understand there is no such thing as a cash fee, and you need to remove that from your vocabulary. You should have one fee for each service. It should apply to every patient, regardless of who's paying the bill. And so your old cash fee is now your Chiro Health fee. And again, you no longer should have a cash fee. You have the contractual network discounts for the patients that are paying out of pocket for their non-covered services, or for those patients with these high deductibles when they opt out of filing their health insurance. Your actual fee is your one and only fee, and it usually is our highest fee, our PI or our workers' comp fee. Now, all of us know that it doesn't matter what you charge, different payers are going to pay us different amounts, and the amount that you charge versus the amount you paid can be different. And these reimbursements are really just part of your what we call the fee system. And the fee system is based on charging everybody the same and understanding that there are times when you will accept less than that actual fee. And that is not a dual fee schedule. You're giving a contractual network discount. I want you to think in terms of a rainbow, because that's a beautiful thing. And what you should see and when you set your fees up properly is every one of your patients should fit neatly within one of these bands. So if a doctor has an actual fee for a first visit of, say, $350 for the services that you see, they may have a routine visit with the actual fee of $185. But if they're under a contract, you're going to see that $350 charge reduced to $220, and that's the contractual network discount. You'll see a routine office visit go from $185, billing the actual fee, down to about $95 for a routine visit. And we all know Medicare only covers 3 codes, and they only pay you one of 2 ways. And so I want you to also know you can absolutely have a hardship fee schedule for your patients. Those patients do not have to join a network to get a discount, but you must have a written hardship policy. If you don't have one of those, as a member of Chiro Health USA, we can supply you with one or the tools to put yours together. Same principle applies when you plugged in Chiro Health USA in your office. Now, some of the clinics, you may have an initial visit of $350, and many of you chose a capped fee of like $150 or $175. Some of you chose a 20 or 30% discount. And you also had the option of saying, I offer a 20% discount with a maximum of 1 fee. Your routine visits, same principle. You might bill out $185, but as a member of Chiro Health, those patients could get a 20 or a 30% discount with a maximum fee of $65. For our Medicare patients, Medicare never covers exam, x-ray, and therapy, and one of the options that you had as a provider is to set a fee for the modalities, for the procedures, re-exams, and x-rays. And those may all be a little bit different in each of your offices. I want to encourage you to have a simple one-page financial policy. The purpose of this is for you to have just kind of a snapshot summary of your overall financial policy. And it might cover things like, what do you do with balances over a certain amount? How do you handle return checks, collection of deductibles and copays? How are you handling credit cards on file or auto debits? And so the policy is simple. It says, in an effort to maintain compliance with various state and federal regulations, managed care and provider agreements, as well as billing and coding guidelines, I have adopted the following financial policies. I have one fee, applies to all patients for every service. You may be entitled to a network or contractual discount under the following circumstances. I'm in your health plan. You're covered by a state or federal program with a mandated fee schedule. If you're a member of Cairo Health, members of Cairo Health USA are entitled to a network discount similar to our insured patients. It's $49 a year, covers you and your dependents. Ask our staff for more information. You could get a discount if you're eligible and choose a payment plan like an auto debit system that would allow for prompt payment discounts, or patients who meet the hardship policy guidelines. And what we did was simple. All the patients that were getting discounts, quote, the wrong way, were put on notice. As of this date, moving forward, our office will be unable to extend any type of discounts other than those listed above. And you have them sign it and acknowledge it. Now, for those practices that may have had some type of prepaid plan or other types of discounts that are already in place, please continue to honor those. And when those expire, then you roll patients over to a more compliant model. So talking to patients about Cairo Health, let's get it going. When do you talk to them? Typically, it's your first contact. You need to decide, are they eligible? Could it be a benefit to them? You might talk to a shopper call. Are they a cash, insurance, Medicare, out-of-network patient, high deductible patient? And as you gather that information, you begin to understand, wow, this is someone that might benefit from having Cairo Health USA. I would highly recommend that the majority of your patients should receive a financial report of findings. Patients often make decisions based on dollars and cents. That's why we'll see so many patients walk in the front door and out the back door when insurance runs out. All right, so let's kind of move into what happens when that phone rings, and let's start with our shopper call. So here's how the conversation might go. The patient calls in and says, how much does it cost to see the doctor? And your staff would say, well, when was the last time you saw them? Well, I haven't been in before. Well, there is no set fee for the first visit, as it depends on what the doctor finds necessary, and it can also depend on what your insurance company requires. And then you're quiet and you listen, and the patient may say, I don't have health insurance. Not a problem, Ms. Jones. That's why we're part of Cairo Health USA. That's a network you can join in the office for $49. By the way, that covers you and your family for a year, and members will receive a blank % discount off our normal fee with a maximum of $175. That typically includes your consult, your exam, and any necessary x-rays and the initial treatment if the doctor thinks he can help you. Do you prefer morning or afternoons? Now, if you're a patient and you call somewhere and they're evasive about the ballpark of what the visit may be, you may schedule an appointment, but you probably won't show up. The patients that are calling your office today are no longer just patients, they are healthcare consumers. And we need to be as clear as we can, as transparent as we can about what they should expect, because otherwise they're simply not going to continue to come into your office. The next type of patient I want to talk about is truly your cash patient. And so if they're checking out for the first time and you determine they're a cash patient, then your conversation can go like this. Ms. Jones, today you had an exam, x-rays, and an adjustment in therapy. The charges for today are $325, unless you have one of those discount medical cards. Do you have one of those? And most patients will say, well, no, I'm not. What is that? Well, Cairo Health is a network that we're part of for patients just like you who are uninsured. You can join right in the office for $49. It covers you and your dependents for a year. You'll receive a 30% discount off of our normal fees with a maximum of $175 or whatever your number is, whichever is less. As you can see, joining Cairo Health will save you more than the $49 it costs to join today. Would you like to do that? If the patient says, yes, I would like to do that, absolutely enroll them. And keep in mind again, you only have one fee, your actual fee. There is no such thing as my cash fee. Let's talk about Medicare patients for a moment. If the Medicare patient is in your office for the first time, you would be going over the charges for the day like this. Ms. Jones, Medicare doesn't cover all the services that we provide in our office. The non-covered charges today that you're responsible for are $325, unless you're a member of a discount medical plan like ChiroHealth. Do you have one of those cards? Well, no, I'm not. What is that? You tell them ChiroHealth is a network that we're part of for patients just like you who are partially insured. Since Medicare will only pay for your adjustment but nothing else, you can join in the office for $49 and it covers you and your immediate family for a year. You'll receive a 30% discount off of our normal fees with a maximum of, let's say, $150 for the first visit. As you can see, joining ChiroHealth can save you more than the $49 it costs to join. And it'll continue to save you money on any of the costs not covered by Medicare during the course of your treatment. Would you like to do that? Doctors, staff, every Medicare patient you see has either been to physical therapy or knows someone who's been to physical therapy. When you set your fees up with ChiroHealth and you're charging $10 or $15 per therapy and rehab, and they know the actual cost of that, say at a PT's office, it really becomes a no-brainer. And statistically, I can tell you over 90% of our Medicare patients willfully pay for services that are not covered by Medicare. That includes the exam, the x-rays, therapy, and rehab. All right, let's talk about the out-of-network call. What I would suggest is to have a conversation like this. So the patient may ask, is Dr. Smith part of the XYZ network? The staff should say, well, no, he's not, but do you mind me asking what your copay is under that plan, because your visits here could be less than seeing an in-network provider. And typically the patient may say, well, I have a $40 or $50 copay. That allows you to continue the conversation. Well, Mr. Jones, Dr. Smith doesn't participate in that network because of the limits they have on your care and the hassles of the paperwork that they put you through. That's why I joined ChiroHealth USA. That's a network for patients just like you. You can join for $49 here in the office, and your membership covers you and your entire family. As a member, there is no deductible, and the most your first visit would be is $125, and the most your routine visits is $45, which is lower than your network rate. Would you like me to schedule you for a consult and see if we can help? And most patients, 9 times out of 10, they're going to say, sure, that makes great sense. Let's talk about the next group, which are limited benefits. And I know the frustration that happens when you're recommending 30 visits and the insurance only covers 15, and oftentimes that patient disappears on the 16th visit. You can stop that by having a conversation with the patient right up front. Let's go ahead and tell patients what the full recommendations are and show them a way to keep their care affordable. And it's by using this type of script. Ms. Jones, the doctor has recommended 30 visits for your care plan. It appears your insurance will help you with the first 15 and your copay is $50 per visit. On the 16th visit, our actual fees apply, and those can range from $90 to $125 unless you have one of those discount medical cards. Do you have one of those? Patient may respond, no, I don't. Not a problem, Ms. Jones. That's why Dr. Smith joined ChiroHealth USA. It's a network for people just like you. You can join it for $49 a year, and as a member, your visits will be capped at $45 instead of $90 to $125. And by the way, that covers your whole family for the year. As you can see, you save the membership fee on the very first visit, and you can continue care at about the same cost as when you have insurance. Would you like to do that? Patients get this. They know that memberships, when they're part of them, they get discounts. It's like a Sam's Club for your health care. Patients that have high deductibles, this topic is getting more and more popular. And do keep in mind that even if you are in their health plan as a participating provider, those patients have the legal option to opt out of filing their health insurance. What you did not hear me say is you can force, coerce, or require patients to opt out. So we have to give them the information to make the right choice. So let's go over that script. Ms. Jones, we verified your benefits, and it appears that you have a $6,000 deductible before insurance will start paying for your care. It's unlikely that you'll hit that deductible during your care here, and those visits you're paying could run $90 to $125, depending on what is recommended by the doctor. And most patients with high deductibles find that care is much more affordable if they use a discount medical card. Do you happen to have one of those? Patient, no, I don't. Not a problem, Ms. Jones. That's why we're part of ChiroHealth USA. That's a network you can join for $49 for the year, and as a member, your visits will be capped at $50 instead of $90 to $125. And by the way, that covers you and your whole family for the year. So you can see you'll save the membership fee on the very first visit, and you'll continue your care at about the same cost as when you had insurance. Would you like to do that? Sure, that makes sense. Now, when you offer a patient or you explain to the patient that has the high deductible, you have to use this form. This is a document that was put together by our legal team, and it is basically a statement. It is called the election to self-pay. Look at your provider agreements. Make sure that you're not violating any of the terms in that. That's not something I can do for you, but you can rest assured that even if your provider agreement says you must file on behalf of the patient, federal law supersedes your provider agreement. Please understand the patient has the right to opt out. They are not required to opt out. And it's a simple PDF form that you can either fill out on your computer, filling in the information. I, the assigned patient, understand and agree that doctor is part of this network. I'm part of this network, but I'm choosing to opt out. That's the long and short of the form. You can certainly read it on your own, and you basically have them date it and sign it, and you file that to the patient's chart. Now, let's fast forward. What if a patient, they go and rupture a gallbladder and their deductible is met 3 weeks later? Now you would use the revocation of election to self-pay when the patient changes their mind. The deductible is met, everything goes back to normal. And basically the patient is saying, I was opting out of filing my health insurance. From this point forward, I want my health insurance filed. You do not go back and refile those claims when they had opted out. They chose to opt out. You only start filing from that point forward. I know most all of us in practice, we always want to grow our practice, and one of the best ways to do it is by taking care of families. And I had the same challenge as many of you did. It can kind of get expensive. My suggestion is if you're seeing families, continue to do so, but let them know that you have a new way of handling that. And you truly can have a tiered reimbursement for those family members. You get to structure those however you would like to. Make sure that when your patients are checking out and they enroll in ChiroHealth USA, that they are aware that this covers their family. Make sure that you're letting patients know that you welcome and that you treat families and that you have a way of making care affordable for all of them. Those are the main categories that we deal with when we're talking to patients about ChiroHealth USA. But I want to talk to you about kind of something outside of the box. Many people look at ChiroHealth and think, well, that's a conversation that just should happen at the front desk or in the insurance department. But the reality is it can happen anywhere. And just imagine this scenario. Joe's coming in for rehab and he's sitting there doing his exercises and he tells one of the staff, you know, I'd really like to get my cousin in, but he doesn't have insurance. Do you want your staff to go, bummer? Or would you like them to say, well, you know, there's really no reason your cousin can't come in. That's the reason we're part of ChiroHealth USA. You know, that's a lot better conversation to have. And again, so what if others hear it? They may be thinking the same thing. So all of your team members should know how to use ChiroHealth to encourage those referrals. All right, we're ready to recap. You need to understand that ChiroHealth is not a time of service discount, and you no longer have what? A cash fee. ChiroHealth USA is for every patient with non-covered services. You have one fee for each service. It applies to everyone. You may be paid less than your charges as part of your contractual network discounts, which can include the health plans, the Blues and the Aetnas, mandated fees, Medicare, Medicaid, discount medical plans like ChiroHealth. You can have a prompt payment, time of service, of about 5 to 15% for your insured patients, but never on the covered services. And you absolutely should have a hardship program plugged into your practice. If patients do not join, they should be charged your actual fee. Please consider using that one-page simple financial summary as a tool to help explain the overall financial policy. And most importantly, to be fully compliant, you should discuss ChiroHealth with all patients for the non-covered services. This should be part of your normal routine during your checkout or the financial report of findings, not just when you think about it. And Yoda said it best, do or do not, there is no try. And honestly, there's no such thing as being mostly compliant.